The team helps the patient in times of crisis. ACT Services was developed to cut the cost of inpatient mental health treatment for the severely ill patient. My PICO question, the patient, is how effective is the assertive community treatment for patients that have diagnosis of schizophrenia, bipolar affective disorder in comparison to inpatient treatment? My intervention is the assertive community treatment. My comparison is long-term inpatient treatment, and the outcome is that individuals will have success in living on their own and being integrated into the community. A change is necessary because the cost of inpatient hospitalization for a severely mentally ill patient is very expensive. It is cost effective to have the patient followed by the ACT team because the services are received at the patient's home. The patients are often too much for the family to deal with. The family may be afraid of the patient due to aggression or the patient having command hallucinations telling them things to do. The ACT team is also non-judgmental. While at the hospital, the doctors, social workers, psychologists, and RN will all work together with the patient to gain compliance to treatment. The patient has to be on board with the ACT services. I would recommend that families with mentally ill patients be exposed to the ACT team because it is a support system for both the patient and the family. Patient's outcome is improved through the assistance of ACT team. The patient is assisted with learning life skills, proper hygiene, coping skills, finding shelter if they can't live with family members, medication compliance, signs and symptoms of their diagnosis, and also with assistance in completing their life goals. The patient will then have a better quality of life. I recommend that the patient being discharged from the mental health facility be followed by ACT team in hopes that readmission to the hospital will not happen. The signs and symptoms of their mental illness as well as medical issues. The patient will have a nurse to follow up with medications, signs and symptoms of their mental illness, as well as medical issues. The doctors will assist in prescribing medication that is effective for the patient. The social worker will provide services so the individual can get services that will help them to live successfully on their own. ACT services has been implemented for some patients that have been released from my place of work. I would evaluate the effectiveness of the program by following up with the patient at least 2 times per week for as long as the patient remains compliant and have no acute episodes. I would expect that our severely mentally ill patients have the support and the necessary tools in order to have the best quality of life that can be achieved. I would expect the patient to remain compliant and gain insight into their illness. I will expect the patient to at least be able to achieve the basic necessities of life. ACT services is an important evidence-based practice that is essential to assisting the chronically ill patient with achieving the best quality of life possible. And these are my references. Thank you.